Good day everyone, good day sir. So for today, we will be doing the musculoskeletal assessment. So the first thing to do is you have to first identify your patient and explain the procedure or the purpose of musculoskeletal system to the patient, and if there are questions, you have to answer those so that there will be no problem in the need of assessing her. So good day ma'am, I am Michelle Passion, your student nurse, and you are Cristobal Mary Kay, right ma'am? So today, ma'am, we will be doing the musculoskeletal examination, ma'am. This is for you to know if there are abnormalities or abnormal findings regarding to your musculoskeletal system, ma'am. And I am asking for your consent, ma'am, if it is okay with you, ma'am, to touch some of your body parts, ma'am, especially to your musculoskeletal parts, ma'am. Is it okay with you, ma'am? Okay, so without further ado, let's start. Okay, also instruct the patient to void if possible and collect the urine specimen if possible. And after that, perform hand hygiene. Okay, if needed, help the patient undress if undress, and provide also a patient gown. And since we do not have a patient gown, we will be using the patient's usual clothes as long as there will be no problem in assessing her. Also, you have to assist the patient in a sitting position. Okay, and after that, inspect the upper extremities of the patient. Also, you have to observe for the skin color. If the patient has yellow skin, it means that the patient may have jaundice. Also, if the patient has pale skin, it may also indicate to pallor. Also, if the patient has blue skin, it may indicate to cyanosis, and reddish skin, which may indicate to erythemia. Also, you have to see if lesions present in the skin of the patient, also rashes, muscle mass, and also you have to palpate for skin temperature, the texture, whether it is uh, uh, too rough or too smooth. Also, you have to see if there are presence of masses. So, let's see. Okay. Also, after that, ask the patient to extend arms forward, and then rapidly turn palms up and down. Ask the patient to raise both arms to vertical position. Place hand behind the neck and place hands behind the back. So let's do. Okay, let's do. Please follow what I am doing, ma'am. Okay, so the first thing to do is, okay, stand straight, ma'am. Okay, and after that, and put your hands behind your back, ma'am. Okay, after. Okay, very good. Please be seated, ma'am. Okay, and after doing that, ask the patient to flex upper arm and to resist the examiner's opposing force. You have to instruct the patient to abduct the arms and adduct and do the internal and external rotation one arm at a time. So, ma'am, you have to follow what I am going to say, ma'am. Okay. Okay, let's do. So, okay. So, like this. Okay. And also back. Okay, very good. Also, after that, bend and straighten the elbow. Also, you have to inspect and palpate the hands, the finger, and the wrists. Also, you have to instruct the patient to extend and spread the fingers. Also, you have to make a fist with thumb across the knuckles. Okay, so let's do. Okay, very good. Okay, and after that, you have to palpate the brachial and the radial pulse of the patient. So let's see. Okay, so far the pulse rate of my patient is normal. Okay, so the next assessment is you have to test for pitting edema in the pretibial area by pressing fingers into the skin of the pretibial area. Also, if an indentation remains in the skin after the fingers have been lifted, pitting edema is present. And also, you have, if edema is present, you have to measure those how deep the edema is by using the tape measure or ruler. Okay, and after that, assist the patient to a supine position, and since my patient tend to choose the sitting position, we will be doing the assessment in sitting position, and also you have to you have to examine the lower extremities, inspect the legs and also the feet for color or if lesions present, also if varicosities, hair growth, also the nail growth, whether it has clubbing in the nail pit of the patient, and also it in also if edema are present, and also the muscle mass. So let's see. Okay, so let's see. Okay. So far, my patient has no lesions, and also the skin or the color of the patient is normal, and also the hair growth is normal, and also there is no edema present, and also the muscle mass. Okay, and after that, test for pitting edema in the pretibial area by pressing your fingers into the skin of the pretibial area. And also if an indentation remains in the skin after the fingers have been lifted, pitting edema is present. And if pitting edema is present, you have to use a ruler or tape measure to measure how deep the edema is. So let's see. Okay, and so far, there is no edema present in the patient. Okay, and after that, you have also to palpate for pulses and skin temperature of the posterior tibial, also in the dorsalis pedis, and also in the popliteal areas of the patient. So let's see. Okay. Okay, and after that, you have also to instruct the patient to spread and wiggle the toes. So let's see. Okay, very good. And after that, stroke the sole of the patient's foot with the end of a reflex hammer handle or other hard object such as a key, and also you have to repeat on the other side. So let's see. Okay, so let's see. Okay, and after that, as needed, assist the patient in a standing position and observe the different range of motion. So the first is the hips and legs. You have to instruct the patient to abduct and adduct the legs like this, ma'am. Please stand like this. Okay, one more time, ma'am. Okay, very good. Please sit it. Okay, and after that, instruct the patient to flex the knee and rotate laterally and medially like this, ma'am. Okay, even. And also you have to do that in sitting position, ma'am. Okay, very good. Okay, and after that, instruct the patients to flex the knees and rotate laterally and medially. Okay, please stand, ma'am. Okay, the other side now. Okay, very good. Okay, and after that, instruct the patient to perform dorsiflexion and plantar flexion. Ask the patient to do the internal and external rotation. Like this, ma'am. The other side, ma'am. Okay, very good. Okay, and after that, instruct the patient to hop with both feet and walk to and from. So let's see. Okay, so let's do, ma'am. Please stand, ma'am. Okay, good. Okay, very good. Please be seated, ma'am. Okay, and after that, perform the Romberg test. Ask the patient to stand with feet stand together, both eyes closed and with arms on the side. Also, you have to wait for 20 seconds and observe the patient and the ability to maintain balance. So, let's see. Okay, so let's start. Please stand, ma'am. Please have your arm, both sides, close your eyes, and just wait for 20 seconds and 20 seconds and please stand. Okay? 1, 2, 3, go. Okay, very good, ma'am. You may now please be seated, ma'am. Okay, and after that, you have to assist the patient in change her clothes into usual clothes. If the patient change her clothes to an examination gown, and also you have to assist the patient in a comfortable position, and also you have to perform hand hygiene and document your findings. That's all, and thank you.